Welcome to episode 99 of our Sperduti Fitness podcast, where we take a deep dive into topics that matter in the health and fitness field. I'm your host, Brian, and I'm here with my co-host, Beth. In today's episode, we have the privilege of sitting down with pelvic floor specialist, physical therapist, Christine Abrams to talk about pelvic floor health. Christine, thanks for joining us today.
Yeah, I'm so excited to be here. Thanks for having me.
We're very glad that
we are excited to have you. So I guess before we jump into pelvic floor health, can you tell all of our listeners a little bit about yourself?
Sure. So I have been a physical therapist since 2015. Been practicing for almost 10 years. And I've had pretty much any PT job that you can think of, whether that's working in hospitals, that's where I spent the majority of my career, nursing homes, pediatrics, anything in between. But really kind of my story of how I got into pelvic health was through my own injury and through needing to be a patient myself. So I'm a competitive Olympic weightlifter. So I compete in the clean and jerk and the snatch. Those are my two favorite moves. And I've competed nationally before. I've gone to the American Open. And so as a musculoskeletal expert, a doctor of physical therapy, and someone who knows their way around the gym, I kind of thought, I know what I'm doing here. I got it all together until I thought that I had a hernia from weightlifting. And I was like, what is the thing that's popping out of my gut? That does not feel very good. I should probably do something about this. So I tried to PT my way around it. I'm also engaged to an excellent physical therapist. And, the two of us putting our heads together really couldn't figure it out. Finally went to go see a surgeon, and he said, I don't know what to tell you, but I can't do surgery for you. So as my stress relief, my hobby, my, all of those things, my identity was feeling like it was slipping away from me. My last ditch effort was to try pelvic floor physical therapy. So after receiving that care, having my mind blown by all of the things that I thought I knew, but turns out I had no clue about, I realized that if I didn't understand any of this, nobody does. So that's kind of how I got into all of this and a little bit of my backstory.
Wow, that's awesome.
I know.
Yeah.
Well, I have to ask, how did you get involved in Olympic weightlifting?
Yeah,
Was there
that
somebody
is
that
by the
inspired
way,
you?
I think
Yeah.
out of anything, Olympic lifts are the most complete technical
Yes.
lifts, so impressive lifts. They're so cool.
Yeah. That's what I love about
Talk to
them
'em.
is they're the balance of, you have to be a complete technician. You have to be dialed in, so focused from the moment that the bar leaves the floor, but you also have to be strong, aggressive, athletic in a way that powerlifting never felt like to me. I certainly train all of those movements, but they don't, light me up the way that Olympic weightlifting does. So like many people who train weightlifting specifically, I found my way into it through CrossFit. So in 2015, the year that I graduated PT school, there's a physical therapist that I really admired who worked out of a CrossFit gym. And I kind of wanted to, learn a couple of things and just be mentored by him. And, awesome therapist, taught me a ton, but he also said, if you want to be involved in this world, you need to walk the walk. So let's throw you into class. Let's get you under a weight. And man, weightlifting has changed my life in so many ways. I did CrossFit for probably about 2 years. I had my CrossFit level 1 coaching, and I used to coach at a gym. But then after a while, I realized I don't like to move fast very much, but I do like to lift heavy things. So that's kind of what I
like it. I like it.
Stuck with weightlifting more. So
Christine, did you play sports in high school?
I did. Field hockey was my fave, but yeah, I have an older brother, so I was just always his little sidekick. So anything he wanted to do, I would do, whether that was baseball, street hockey, football, you name it. So yeah.
Fun.
Mm-hmm.
Are you still Olympic lifting competitively?
Yep.
Awesome.
It's about to be garage season, which is my favorite time of year. So I built a platform for my garage. Luckily, I can get overhead in there because I'm not too tall. So that's always my favorite thing to do this time of year is bring my speaker outside, throw down some weights, and just have a good time. So
isn't that the best? I have a garage gym also, and there's just something about, like, I go to a gym, but there's something about just garage lifts that are just cool. Like, and they're just so cool.
Is
Mhm.
except for when you remember my story when I went out, it was
Oh
like
my
5 o'clock in the
gosh.
morning and I put my speakers on thinking it was inside my garage, but I turned on my exterior. So it was like 5 o'clock in the morning and I'm blasting Rob Zombie while I'm working out. I'm like, why does it sound so quiet? No, because my neighbors were listening to it, not me. So
Right.
sorry,
Oh, I
everybody.
love that wake
Oh,
up call.
yeah. Everybody knew I was getting my workout done though.
Yeah.
Do you have any planned comps coming up?
Nothing really on the books right now. My fiance and I and his partner, we just opened a new physical therapy clinic about 2 months ago. So that has been happening. And then I am getting married in June. So there have been
Oh,
other other things that I've been planning for
oh,
lately. So just kind of
congratulations. That's
focusing
awesome.
on. Yeah, yeah, we're super excited.
That's awesome. So
Mhm.
let's jump into it. Can you explain to everybody out there what the pelvic floor is?
I love it. Great question to start with. So probably how I'll begin is by debunking the fact that only women have pelvic floors, right? Any person with the pelvis, you have a pelvic floor. So I brought some of my models because I'm a very visual person. Um, so this is our typical female pelvis. What we see here, everything in red is a muscle. That's all your pelvic floor. And so we can see how these muscles connect to the sacrum, to that pesky SI joint we hear so much about, to the pubic symphysis, and then around these muscles that help stabilize our hip and create hip rotation. If we're looking at our male model, we can see there's no bony pelvis attached to this, but same series of bright red muscles, right? All the same things. And these are also two of my other favorites. If we're just comparing the female and male models, we can see that they're really the exact same set of muscles exteriorly and interiorly as well. So just to begin with that as kind of our base of knowledge that we all have one and they look pretty darn similar. So the pelvic floor is really a muscular sling that sits at the base of the pelvis and has 5 main roles. It helps to support our organs inside of our body. It helps us with sphincteric control, deciding when we go to the bathroom, helps with sexual function. It helps with stability, making sure that our legs stay in line with our core and our pelvis, and then with the sump pump function to help move fluid throughout of our body, the same way that your calves help circulate fluid from our legs up to the top half. So those are kind of the big main roles. We think of the pelvic floor as, our Kegel muscles, and that's about it. But they have way more jobs, so many more jobs than a bicep or a quad does. So they're pretty fascinating.
So does the pelvic floor incorporate the core muscles?
That's a great question. So I always like to think of the pelvic floor as being the base of the core because a lot of times when we hear core, we are thinking really about our abdominal muscles, when in fact, that's just one piece of what the core really is. So there's a physical therapist, her name's Mary Massery. She's brilliant. She teaches so much of the thought process between how respiration and our diaphragm all kind of work together. And her example that I steal all the time, because we steal from the greats, is how our core is like a can. So we have to think about all of this like a pop can, okay? And so if we have that visual in our mind, we can think of our diaphragm being the top of the core canister and the pelvic floor is the bottom. Everything around that, abdominal muscles, low back muscles, glutes, are all the remainder of that can. So when we say core, that's what I want you to think of. Diaphragm on top, pelvic floor on bottom, everything else around. And so we know that a can is really, really stable when it's sealed, right? So if you have a can, you're at the Bills tailgate and you want to, try to stomp on it or crush it with your hand, you're not going to do a very good job at that. But if you take that same can and you open the lid and you release some of the pressure, you can crush that can with your hand, you could step on it, and it's not so strong anymore. But the can was never strong in the first place because it was made of aluminum. Aluminum's not very strong, but pressure is very powerful. And so that is a concept that really influences how I practice, how I think about bracing, how I think about moving, and was a huge thing that influenced my lifting and how I treat as a therapist. Because we can't just look at your core as your abdominal muscles. We need to understand that the pelvic floor is the base of that, and everything in the neighborhood is really strongly related.
And when we look at like pelvic floor, we look at core. And when people hear pelvic floor, they often talk about Kegels. How do Kegels play into all this as well?
Great question. So when it comes to Kegels, I think it's important to understand that what we know from the research is if you take a room of people and you ask them to do a Kegel or activate your pelvic floor, 60% of those people are not able to activate their pelvic floor on command. And this is for a number of reasons, partially because, societally, we don't talk about that. Don't look there, don't touch, that kind of thing. Sometimes there's, an emotional component to this, but it's also hard to, access these muscles because we can't watch them do their job the way that we can other muscles in our body. So the motor pathway in our brain can kind of shrink down, and it doesn't have a great representation from the motor standpoint. Our sensory area for this part of our body is huge. Lots of good sensory innervation, but motor control, volitional control is kind of hard to do. So that's kind of where I like to start, is that most people can't activate their pelvic floor on command. Of those 40% of people who can, half of them do it wrong. And again, that's because whoever taught you how to do a Kegel? Probably nobody, right? If you're a female and you go to the gynecologist, they say, oh, just go do your Kegels. And what does that even mean? Has anybody ever taught you to do that? And I always, have my little snarky remark when someone says like, oh, pelvic PT, you just teach people to do Kegels, right? Do you think I went to school for a decade to teach people to just do this? No. So there's so much more to it than that. So absolutely, Kegels are a great tool for isolated strength, the same way that bicep curls are really great if you want strong biceps. But sometimes we need more than that. So, if we're doing pull-ups, then you're getting strong lats, you're getting stable through the chest, we're bringing in the core, and your biceps are getting strong. Awesome. So that's kind of why only in rare instances do I truly prescribe Kegels to people for strength if there is actually a pure pelvic floor weakness. But probably 7 out of 10 times, it's the core as its entirety. It's that the breathing mechanics are off. It's that there's a weak link in the low back. It's that the glutes are tight, and maybe the pelvic floor doesn't have great coordination or endurance. And these muscles are muscles like anywhere else in the body. You wouldn't just expect that weakness is the only problem that you could possibly have somewhere else, in our body. You might think, oh, maybe my endurance is a problem. Maybe I get fatigued too quickly, or the coordination aspect of this is off. Same thing can happen with these pelvic floor muscles. They're the same as any other in our body.
Wow. And is that how you would typically do like assessing a patient's like pelvic floor concerns? Would you take them through like a series of tests?
Definitely. So I always say this is kind of like regular physical therapy in the way that we're always looking at strength, coordination, endurance, and other things in the neighborhood. I'm not sure if you've ever had to get PT for anything before, whether it's your shoulder, your knee. Chances are they don't just look here and stay here. They're looking at the chest, they're looking at the neck, they're looking at everything in the back. Same thing with pelvic floor. If all you ever do at your pelvic PT's office is lay on the table, they're doing you a disservice. They need to have a strong orthopedic background. They need to see how you move. They need to make sure that, what does bracing mean to you? How are your glutes functioning? Do you have tight adductors? What's your hip rotation look like? Where do you have low back pain? Is there an issue at the sacrum? All of these things. So we're taking definitely a big zoomed out picture, look at what's going on. In addition to, so many of these things are really rooted in bad habits, miseducation, misinformation, these myths that absolutely need to be debunked of, pee every time you feel your bladder fill even a little bit, or you'll get a UTI, any of these kinds of things that are so pervasive in our culture and that we hear medically all the time that wind up having all of these implications. And we need to really reel it back, look at the whole person, get to know them, and understand, why are these muscles doing what they're doing? Muscles are stupid. They can do one of two things. They can contract or they can relax. So they're not running the show. They're not deciding why they're doing what they're doing. The nervous system is, our habits are, our postures, all of these kinds of things. So yeah, kind of like regular PT.
It's amazing. Christine, can you discuss the role of the pelvic floor muscles for overall health and wellness?
Great question. So in regards to like how we lift, how we move, like in just like overall, what are your thoughts?
Well, as a woman that has had 4 children of her own and does massive, I do some heavy lifting. Every time you're talking about a muscle group, I'm over here like, oh, adductors, I'm squeezing things and I'm trying to feel things. And I'm like, am I even doing this right? So for me, it's something I've never really took into deep consideration, even though I have gone to PT for other parts of my body, this
Sure.
is something I have definitely neglected myself. So
Mhm.
I'm really happy to have this conversation and this topic, because I feel like it is something that I have kind of pushed aside, and
Mhm.
I want to make sure that I am having the healthiest body from head to toe.
I love
So
it.
I do feel like, wow, when you brought up all those points where all those different muscle groups, working together, and I'm like, oh my God, I know, and you're right. So
Yeah.
for me, it definitely is important to me for taking that look into your overall health and wellness.
Definitely. And a lot of us, females particularly, we think that we're kind of getting the once over every year when we go to the GYN, when really, I look at things so differently than they do. I'm a musculoskeletal expert. They're a medical expert. I certainly can't do what they do. They're looking, are your organs where they need to be? Is everything, hormonally okay? Are you having any issues? I'm looking at, what's the tone and texture of these muscles? Do they play nicely with others? Functionally, what issues are you having? Whether that's something that's like a teeny tiny little thing that's just bubbling under the surface, that's like not that big of a deal, like everybody does it. When really so often these are little simple fixes that can carry on for a lifetime. Like I said, I spent the majority of my career in the hospital, and I know this sounds hyperbolic, but what I saw over and over again were, these like little old ladies who can't make it to the bathroom fast enough, who have to wear a brief and all of these things. And I know this sounds kind of crazy, but the stories that I would hear over and over again of, people getting up in the middle of the night, can't make it to the bathroom fast enough, fall and break their hip, then they wind up in with a UTI, then they go to a nursing home. And of course, when we're talking like big zoomed out picture of what is health, how do we want to age well, it's easy to think about me right now, but these are little things that can really snowball if we're not, smart about them. So having good habits at any age, I truly think that everyone should get a checkup from a pelvic PT yearly, the way that we do, from our GP, from our GYN, just to kind of touch base on, all of these things. Are you aging well? Do we have any concerns? Just so we can stop it before it starts. I always say, like, you wouldn't wait for your house to burn down before you call 911. You smell smoke, you call 911. Same thing here. Like
God.
preventive medicine, it's the name of the game.
And you talked a
So
bit about like some common misconceptions when we talk about pelvic floor health. Can you talk a little bit about that? Like some misconceptions when it comes to that?
Hmm. How much time do you have? um,
Till the sleepy
I,
time tea kicks in.
I feel like my field is so misunderstood that honestly, most people don't even know what my job is or that I exist. So of course, there is so much misinformation out there. Some of the ones that I hear over and over again, everybody thinks that I'm going to tell them, oh my gosh, your pelvic floor is so weak, your guts are about to fall out. No, honestly, the majority of the time, the issues that I see at the pelvic floor are related to pelvic floor tension. So Beth, kind of like you were saying, like, oh, am I clenching my adductors? Why am I squeezing my glutes? Am I sucking in for no reason? All of these things, like I see way more pelvic floor tension than I do actual weakness. So the way that I make it make sense for everybody is if you're trying to do bicep curls and you can't, move through a full range of motion, you kind of stink at bicep curls. But if your muscle is so tight that you can't relax it, you still stink at bicep curls. So you are just as bad at them if you cannot move through a full range of motion in either direction. Same thing with our pelvic floor muscles. A lot of times, if I see someone with incontinence, pelvic pain, any of these things, that's largely related to pelvic floor tension rather than weakness, believe it or not. So that's a big misconception. Another one is that pelvic PT is just for women. Only women have pelvic floors. Truthfully, I treat a ton of men. I love working with men. They're my favorite patients. They are so like you tell them to do anything, they're like, fix me yesterday. I will do it. Like they're so engaged. Like they love it. They love coming. So I really love working with men. And I think just generally there's so much there have been so many women who are just kind of force-fed birth control from age 16, and that's kind of where the conversation stops. There's not a lot of informed consent about hormonally how that can impact things, how sexually that can impact things, and that there are other alternatives. So those are kind of some of the nuanced conversations that I like to have. And gosh, also like, wow, do we need better sexual education in this country? Because I work with a couple people who, young people who have no clue how any of this works, or, that pleasure can be part of the equation, or really how contraception works, or all of these things. So I do definitely kind of put my medical hat on sometimes. And I really like kind of filling those roles that are a little bit missed.
Man, can you go into the hormonal conversation piece?
What is our way to go with that? Like,
If you want to take it as much as you can. I mean, I would have never have thought that hormones, like you said, with putting our youth on birth control, how that affects pelvic health.
Absolutely. Yeah. So one of the things that, so plenty of the people that I treat, have pain with sex, whether that's, with erection, with penetration, what have you. But for our female clients who have been on birth control for decades, what they don't tell you when you get prescribed birth control is there can be vulvar and clitoral atrophy when we are not the ones producing our own exogenous estrogen. Yes, yes. Wouldn't that be a nice one to hear? And believe it or not, you see it a ton. You see it a ton.
Horrible.
It is horrible, which is why I really encourage everyone to know exactly what you look like. Take a mirror, go take a peek so that you know, because I'll say to people, this is what I'm seeing. How does this sound to you? Like, is this kind of how you seem? And they'll say, I don't know. I guess I don't even really know what I look like down there. And that's another part, the same way that like we go to the dermatologist to get skin checks to make sure, like, has that always been there? I don't know. We should know what this area of our body looks like because it can change so much. So yeah, I think that's one thing that, man, everybody should hear that. And, I don't think that there's enough education around how to train around our cycle, what different parts of our cycle feel like, even just an understanding of what that is. I see so many people who come to me they're like, I have this weird back pain that I just can't get figured out. And then we really like look at their training cycle and we find out like, okay, whenever you're luteal, like, and everything's tanking, there's a little sacral instability. Your pelvic floor muscles, which are estrogen dependent muscles, are not as stable as they normally are. Maybe we should take that training back a little bit and work around that. Something else that I see all the time, unfortunately, in my postpartum moms, they're not getting good education that when you are breastfeeding, all of the estrogen dependent tissues in your body will respond to that. And so those estrogen dependent tissues are our breast, our abdomen, and anything vulvovaginal pelvic floor. And so that's what I always tell people is your little mini menopause. Those muscles aren't going to have enough strength, lubrication, coordination, blood flow the way that we're typically used to. And so when I have people who are doing everything right, they're doing their PT, they're doing their stretching, their exercises, they're like, why am I just not getting better? I don't know what's wrong. It's because the hormonal deck is stacked against you. And so that's sometimes a really nice thing to hear when you're a couple of months postpartum and you're like, I'm doing everything, what's going on? So estrogen plays such a huge role. And also, if we knew that having a good store of our ovaries doing their job for our 25 years of reproductive cycle, that can help us have a much better transition through perimenopause because our ovaries have been doing their jobs for a long time instead of being asleep at the wheel. So, maybe not the conversation that a 16-year-old cares about, but maybe the conversation that her 40-year-old mother might be saying, do I really want to do this to my kiddo? So
I've always said birth control is a whole podcast within itself.
yeah.
I don't think there's enough long-term research, and I think a lot of we just don't have enough research on it long-term to really know what it actually does to the female body.
Right. And we're just using it to mask symptoms and put a Band-Aid over things for a lot of people. Oh, you have acne? Birth control. Oh, you have PCOS? Birth control. Oh, you have anything? Birth control. So that's, the question is always why, right? We could throw a Band-Aid on anything, but why? So that's where I think as a medical community, we need to start doing better.
And speaking of taking, track and knowing about the cycle with Brian. I know he's like spinning his wheels right now, trying, oh my gosh, we're talking about luteal phases, and Brian.
Yeah, follicular and luteal phases. Let's go.
I know.
Yeah.
That's
I'm gonna
Brian's
blast around my guy
right
friends. They're like, how are the bills? I'm like, how's the late follicular phase? What do you guys think?
Well, it's so important because our clients, that's something that we talk with our female clients about, is that it's very important for them while they're working with us to be tracking their cycle. And we need to know what's happening in their cycle, because it is very important around those times of the month when they're feeling a little bit hungry, they're feeling weaker, and they need to realize and understand it's not just you, it's your hormones that are in play. So it's amazing how hormones can be mismanaged in such a way. Holy cow.
I love it. I'll do that. That is like, you're doing the Lord's work. So
I always say it's pretty unfair to compare week to week weight loss. You really need to compare with female clients cycle week to cycle week, because each week your body's doing something different.
Yeah.
So if you say, oh, look, I'm up in weight this week, and it's like, well, are you getting your period? Because you're still lower than last week when you got it. You can't just compare it to the week before. So you have to be a little bit more, you have to pay a bit more attention to what's going on from cycle week to cycle week. And, what, are you on birth control? Are you on, PCOS? Do you have amenorrhea? Do you have, any of those things? I always I'm like, there's no TMI. Like, tell me everything. The more info I have, the better it is for all of us, because then I can take an educated, approach to what's going on.
Right. Yeah. And it can be so frustrating, especially, as a weightlifter. I lifted in a gym with a ton of power lifters, when they're just like, I can't hit my percentages this week. And it's like, yeah, your program needs to change with how your body changes.
Yeah.
You can't women are not small men, and
Yes.
research treats women as small men. And that's just not true. All the research is done on 20-year-old men, college age men who want $15 to go be in a study at the exercise science program, and that's just like, oh my gosh, that just needs to change. So,
yeah. And I think people don't understand how important that information is about programming. Like, maybe we should deload during this time. Maybe we can push during this time. When are you feeling good? You know what I mean? Because between all the hormones that are going on, you get, progesterone, estrogen, a little bit of a testosterone spike, but that might be blocked because there's just so much information. Men are just boring. We got like one hormone that just declines. You know what I mean? It's kind of boring.
It's hilarious. My chart that I always love to show during presentations of how hormones change throughout the life cycle. It's guys, it's like, testosterone, and it just kind of like slowly levels off with age. And women, it's like the dragster at Darien Lake.
Yeah. At some point, it just shuts off. You're like, whoa.
We're done.
We're done. It is. Again, I don't think people understand how important that information is. I just think that we're behind the times in how we approach a lot of things. We're very behind the times because, again, only studies have been done on men, and they never really have ran long-term studies on women in fitness.
Right. Yeah. And it's crazy. I, in my little pelvic PT circles, I thought it was so hilarious when I heard that in Europe, the phrase, I laughed so hard I peed my pants, doesn't exist, because pelvic PT is something that every person that has a baby, they get it. And it's part of their insurance, and it's part of the plan, and it gets prescribed. And like, people just don't do that. So that's, speaking of being behind the times, and we need to catch up. Like, good job, Europe. You're crushing it. So someday we'll be like you.
Yeah.
Wow.
And it's amazing because you almost ask yourself, like, why aren't they getting that treatment? Like, everybody should have an education on that. You know what I mean?
Yeah.
So let's see. Okay, Christine, you're going to have a room in our building that we create one day.
Yeah, it's our super friends of health and wellness.
Welcome to, I don't know what we're going to call it, this Sperduti cave. Brian, oh my God, here we go. Now it's going to happen.
So come up to my door, ask me all your questions.
All right. So Christine, do you feel that there have been specific lifestyle factors or habits that you commonly see that are contributing to pelvic health issues in your patients?
Definitely. One of my favorite questions to ask someone after I'm doing an exam, I'll say, are you a clencher? And they'll be like, oh my God, yeah, like all the time. Like my shoulders are on my ears, my jaw, my hands. And I'm like, yeah, your pelvic floor feels like you're a clencher too. Like people read palms, I read pelvic floors. Like I know that you're a clencher from, doing an assessment. So that is a habit. People don't realize how much they are clenching their glutes, they're sucking in their abdomen. And again, if we're thinking about that core like a can, you're crumpling your can in two different parts. It's not going to be very good at its job. It's not going to be very stable and manage your pressure well. If you're a clencher, if you're a sucker inner, that's a habit that I see all the time. Something else that I see often is people who are very frequent with their urination. And so they're peeing just in case. Oh, I'm going to Wegmans. I'm just going to pee just in case. Or I work from home and I'm bored and I wanted to get up, or my kids are driving me nuts. So I'm just going to go be in the bathroom for a second so they can't bother me. So I'll just go pee. And then we see this urinary frequency cycle that starts to begin. And I always remind people that peeing 5 to 7 times a day is what's considered normal. And that shakes out to every 2 to 4 hours. And so most people, when I say that, their eyes explode in their head and they say, I go 5 to 7 times a day before lunch, So the problem with that is our bladder becomes intolerant of filling if we empty it too often. Again, the bladder, the detrusor, the smooth muscle that surrounds it, is muscle like any other in our body, and it gets trained to the stimulus that we put it under. So if you only ever lift 5s, you're only ever going to be able to lift 5s, right? You'll never be able to lift that 50. So if your bladder, you empty it every time it's this full, you're never going to be able to fill it this much. So that's something that I see become problematic, and can wind up leading to more pelvic floor tension because the muscle is just irritated all the time. It's emptying more than it should be. It's working harder than it should. Other bad habits that I see in the bathroom are people that power pee, they push to pee. And really all of the muscles surrounding the urethra should open up and relax so that urine can come out instead of trying to use pressure to force it out. That can also create some of that pelvic floor tension, in addition to people hovering because they don't like to go on a public toilet. They don't want to sit down all the way. And I treat a lot of weightlifters and I'm one myself. And so I have a bunch of people who leak when they squat heavy or deadlift heavy. And I'm like, okay, so when you're squatting and you get stuck, just, out of the top, and that's when you start to pee, but that's also where you pee when you're not sitting on the toilet. Aren't we kind of sending your brain a mixed signal, right? Sometimes it's okay to pee here and sometimes it's not. So we need to kind of get a little more consistent here. So those are some of the habit things that I see. One of the sexual function bad habits that I see often, I ask my female clients this all the time, is, are you clenching your way to an orgasm? Because at the end of the day, what is an orgasm? It is a strong, rhythmic, coordinated contraction and relaxation of the pelvic floor muscles. So like the ultimate party trick. And a lot of things need to happen for that to occur. And so what a lot of females wind up doing is clenching and tightening these muscles so that they are more contracted and then kind of forcing their way into an orgasm. And so because of that, we can promote that pelvic tension cycle. We can also kind of mute like the full expression of it, and then we don't experience as much pleasure. And really the relaxation piece of that is just as important. And so again, if we're relying more on tension to do the job rather than pure strength of the muscles, this can be a problem over time. And then we kind of get dependent on, certain stimulus that we need. Again, muscles are trained to the stimulus that they're put under, just like if we're in the gym.
This is all fascinating.
I love this stuff. I could how much time do you have? Because it's
seriously, it is absolutely fascinating.
What advice would you give patients for maintaining good pelvic health? And to piggyback off of that, what are some of the risk factors of having a weak pelvic floor?
Great question. So some of my favorite things just generally, good bowel and bladder habits are key. Like I said, making sure you're going an appropriate amount of times a day, 5 to 7 times a day is ideal for urination, making sure that you're not pushing, you're not straining, good bowel movements daily, ideally. every other day is pushing it, but can be normal for some people. Honestly, probably going twice a day is where we really all should be. Good bowel and bladder habits, because then we're not putting the pelvic floor muscles kind of at risk for learning bad habits that can kind of carry away as we age. And also that we don't put ourselves at risk for pressure management problems. And so, like we were talking about, that core is a can. We are all full of pressure the same way that that can is. But for us, it's intra-abdominal pressure. And this pressure is important because it helps us move, be stable, stay upright, lift heavy things, do cool stuff. But in the pelvic PT world, intra-abdominal pressure can kind of get a bad rap sometimes because there's a series of pressure management problems that we can experience. And there are things like prolapse, stress incontinence, hernias, herniated discs, all of these other kinds of things, diastasis, that's what we see, the splitting of the abdominal wall during pregnancy. And so all of those things, if you have any number of those things, that tells me there is a problem with the way that you manage your intra-abdominal pressure, and it is finding the path of least resistance. Again, if we're going back to that can, if you go to shotgun that can, right, and you pop it with your key, that pressure is going to find a place to leak out. And so same thing with us. If there is a mismanage somewhere in your whole core canister, then we are going to have a pressure management problem. So learning good habits, whether that's how to cough the right way to maintain your intra-abdominal pressure, the correct way to have a bowel movement, how to push your baby out if you're pregnant, why we need to mobilize scars after they happen, whether it's a C-section scar or an appendectomy, any of those things. Scars need to move, scar tissue needs to move. All of these things are pretty simple, but really can change your life. And again, would just be nice things for someone to tell you. So I really love all of that. I think we really need to dispel the myths that, oh, it's normal to just leak a little bit when I cough, laugh, or sneeze because I had a couple kids. No, that's 100% not normal. It's very common, but common and normal are not the same thing. And again, in gym life, in the heavy weightlifting world, there's a lot of normalization of stress incontinence with heavy lifting. And again, I'm certainly never going to shame anybody or make them feel bad about that, but that tells me there's a weak link somewhere in there. And what I've seen over and over again is once we fix that problem, people's totals go up. They can squat more, they can deadlift more, they can clean and jerk more because they are not leaking pressure anywhere. Sure, the leak shows up as urine, but that's not really the problem. It's that, there is, in that pressure system, there is an issue. So getting people, that's usually how I get my weightlifters, is I'm just like, I know you don't care, you'll wear a pad on meet day, fine. But do you want your total to go up? Because if you do, come hit me up.
Sold. So
Yeah.
you know what I mean?
More kilos, I got you.
So pelvic floor and fitness definitely intersect. It's a major
Absolutely.
go hand in hand.
You got it. Yep.
So now I wanted to get into some other topics. You talked a little bit about pregnancy. So we definitely want to ask if you can explain the importance of pelvic floor exercises, maybe during pregnancy, how they can help, for expectant mothers, maybe before, if you're planning to become pregnant. Maybe you can touch on that topic a little bit.
Absolutely. I love it. Pregnancy is one of those things where we have so many predictable changes that occur. There's not a lot of surprises. We know how the baby grows. We know how the pelvis opens. We know the patterns that most people wind up, going through. We also know typically what postpartum is going to look like. You're going to have a little kettlebell that starts out at about 7 or 8 pounds and gets bigger every single day, right? That's your baby growing. And so you need to be strong. And I look at pregnancy as the time to prepare for postpartum, because that's really what you need to be training for during your pregnancy. I love to dispel the myth of, oh, I'm pregnant, so it's just time for me to relax and rest so that I can grow this baby. And if you're 36 weeks plus, yeah, you should. But I tell everybody weeks 0 through 36, we're thinking strength, stability. I need you to be active. Sure, that first trimester, you're probably not going to feel like it too much. If you can get off the couch, I'm happy with that. But second, third trimester, we got to be on the move and staying stable. So there's not a ton of pelvic floor specific strengthening. So I'm not really saying to all of my pregnant folks, oh, make sure you go do Kegels, because I really don't. But what I am doing is I'm getting them to understand the relationship of their breath to their pelvic floor, because like we talked about, the diaphragm is the top of that can, pelvic floor is the bottom. And when there is more pressure in that abdomen, that intra-abdominal pressure, if there's a baby in there taking up space, there is inherently going to be more pressure in your core throughout the entirety of your pregnancy. And it gets more and more and more every single day. You're like, oh my God, how did I do this 4 times?
That's exactly what I'm thinking, Christine. I'm like, I think I need to come in.
Yeah.
I'm good. I just have
I'll
one
be there
hormone.
tomorrow
That's
morning.
just, I'm good. I just,
Now, I have a question for you. So now that we're talking like child, the pregnancy and childbirth and things, and I'm thinking about the pelvic floor and the muscles, and you're talking about scars and C-sections and things like that. So does a woman that has to have an episiotomy affect the pelvic floor?
Yeah.
Oh,
Yes.
man.
Yeah, absolutely. Because again, that's an incision and those are stitches and that's scar tissue. So yeah, again, would have been a nice thing for someone to say, like, that should probably get mobilized after this incision, So yeah, good. Like, again, informed consent. But yeah, so I have so many C-section moms who are like, nobody told me to move this thing. And here I am 2 years later, I've got a toddler and I've got a shelf, what is like, why can't I get this? Why does it still look like I'm pregnant? And it's because the scar tissue got laid down and nobody lets you know that you need to move that. Or again, the thing that I tell all of my C-section moms right off the bat is you need to be belly breathing, because that is the best, easiest way to stretch and move that scar in those first early 6 weeks. That isn't going to put your incision at risk, any of those things. So yeah, oh my gosh, I will die on that hill. Scars need to move. But yeah, back to during pregnancy, what are some of the like big things that I think most people should think about? Core training is safe during pregnancy. I will shout that one from the rooftops until I can't anymore. Core training is safe during pregnancy, and it is advised because, again, your core muscles have never had to work so hard. They need to be working better than they ever have. They're changing shape. Their attachment points are further from each other than they typically are, and so they're a little bit less effective. So we need to get them as on and popping as they can be. What we think of as typical core training is our general like flexion extension movements. So forward and backwards, we're thinking like sit-ups, right? Those probably not super advisable during pregnancy because not very easy to do with a bump. And we have too much of that as it is. Most people, when I feel their abdomen, I notice that the rectus abdominis, those 6-pack muscles, are usually very dominant. They're working too hard. And then everybody else is asleep at the wheel. So obliques, internal, external, not doing enough work. Transverse abdominis, deep core, PS, best friends with your pelvic floor, not doing enough work. So there's such a huge imbalance here. Rectus abdominis needs to chill out. So most people could cut the majority of their flexion extension based exercises, their sit-ups, their, that kind of stuff. We should be adding in more of your anti-rotational work, your multiplanar stuff, diagonals, crossing midline, Palloff presses, side bridges, like all of these kinds of resisting rotation movements. And with that, the transverse abdominis, that deep core, that's the muscle that hugs our bump in when we're pregnant. And what we know from EMG studies, like nerdy PT studies of what makes muscles do their job, your transverse abdominis, quickest, easiest way to activate that muscle is exhaling through pursed lips. That's just the cue that works very, very well for most people. Kind of hard to screw that one up. And what we know, because of that whole core canister, as we're breathing all day, every day, when we inhale, our lungs fill up with air, our diaphragm descends to get out of the way. Because we're not hollow, we're full of stuff. Our pelvic floor gently relaxes when we take that deep breath in. And then as we exhale, lungs empty, diaphragm lifts, abdominal contents lift, pelvic floor lifts back to its resting position. all day, every day that is happening, because if it didn't, every time we took a deep breath in, we would pee our pants. Okay. So what we know, because of that relationship that exists, if instead of just a regular sigh exhale, if we do that pursed lip exhale, transverse abdominis will come to play. And again, when that muscle is active, and as it automatically will be for any and all people with that pursed lip exhale, then pelvic floor activates and engages with that at the same time because of the relationship of that whole core canister. So again, like mind-blowing moment.
Awesome.
I love this stuff.
Love it.
So that's what our pregnant people really need to understand, because that whole experience really gets turned on its head for them. But every single person that I say this to, and again, myself, when I learned it, like complete mind-blowing moment of how to activate really everything all together in a very functional way. Not the, oh, I'm doing a Kegel, this is my bicep curl and just my bicep curl. No, this is your pull-up. This is your back, your lats, your biceps. Like, we're bringing it all in this way. So much more functional.
That's awesome. We did have a question come in.
Yeah.
And it was, what recommendations do you have for recovery after hysterectomy, and how soon can I start exercising afterwards?
Great question. For the how soon after, the always answer, ask your surgeon. What ends up happening is you'll go and you'll have that 6-week post-op follow-up, and they're going to say, get back to your life. And, you have no restrictions. And the problem with that is, what does exercise mean to you? That might mean I want to go to my gentle yoga class. That might mean I'm an Ironman, and that might mean anything in between. That might mean CrossFit. That might mean I want to go ride a bike with my kids, and so that's again where a musculoskeletal expert, a pelvic floor physical therapist, really should be the one saying, I think you're ready to start running again. I think you're ready to do all of these things again. So I'm sorry, the first question was, when can I get back to exercise? What was the other question?
Recommendations. What recommendations do you have for recovery after a hysterectomy?
Great question. So hysterectomy is one of those things where I always joke about this. Like, I never thought I'd say this, but God bless Reddit, because Reddit has gotten so many people in my office post hysterectomy. Some of these message boards on Reddit are like, pelvic PT was the best thing I ever did post hysterectomy. And truly, this is a major surgical procedure, so we should know about this. One thing that I wish everyone would hear before having their hysterectomy is the uterus has a strong ligamentous supportive role in that container of our core. Okay. And so if we're going back to this bad boy, if your uterus is sitting right in here, where it attaches to the pelvic floor and to the inner wall of the abdomen and the pelvis, that organ is not just for having kids. That is for stabilizing everything else in the pelvic floor because of its attachment points. So again, this is not to say that this will happen, but you are at an increased risk for pelvic organ prolapse if you have a hysterectomy, because there are not as many stabilizing support systems. So with that being said, you really, really need to understand how intra-abdominal pressure works and how to use it to your advantage and not have that be a problem that it worsens over time. So that goes back to when you cough, laugh, sneeze, jump, lift. If you feel that heaviness, that, oh, I might pee my pants a little bit, I might leak, that tells us that there is a pressure management problem here. And those are things that once you learn it, you've got it. And then you can carry that with you for life. But with hysterectomy, we really, really need to know about this. Additionally, that means good bowel habits. You're not straining when you're having a bowel movement. That's something that, again, we're doing every single day. And so you want to be doing that correctly every single day. So that's a really important thing to know hysterectomy wise. And on top of that, it all depends on what exactly was removed during the procedure, because it could be anything from, just the uterus to including the cervix, tubes, ovaries, depending on the person. Knowing what your hormonal implications will be based on what kind of hysterectomy you had and what this means for you long term. If there's a cancer risk, there may be, they may be less inclined to prescribe any kind of hormones. But for any female that is over the age of 45, topical vaginal estrogen is the new wonder drug. Okay, so there's a phenomenal sex medicine and urologist doctor. Her name is Rachel Rubin, and she does all of this amazing research on topical vaginal estrogen for women. And so her thing is at the age of 45, all females should get a lifetime prescription for topical vaginal estrogen, a colonoscopy, and a mammogram. Okay. And so 45, which is not old, not even a little bit. And so we think like, oh, menopause, that's like, that's like way down the line here. Right. And really, we know from how hormones change that this is when we're starting to see those estrogen dependent tissues start to lack. Okay. And so not only is topical vaginal estrogen so beneficial for preventing UTIs, particularly as we age, we know that is a problem for us, as we get up into our more like 70s, 80s, sometimes even sooner if you're more predisposed to that. But with that local hormone that can make our muscles so much more robust and strong, get them that good blood flow, help with lubrication, things that can become problematic if you do in fact have your ovaries removed with a hysterectomy. So that's one that I am like trying to get everybody to hear me say so that they can go ask their GYNs for a prescription, because there's really very little risk. There really is not a cancer risk for that. There's amazing studies for that. I'll send those to you guys if you're interested.
Please.
So yeah, there's no reason for anybody to not be on that. So.
You
Wow.
have blown my
Hopefully that
mind
answers your
tonight.
question. That is, yeah, we got to have you on again. I have so many notes jotted down here that we have to have you on again.
Sherry, I need her
We got
contact
it. We
info.
got you.
Yeah,
I
we
got you.
Sherry.
Just to circle back to pregnancy, what are some signs or symptoms that indicate a pregnant woman may need specialized pelvic floor therapy?
Great question. There are definitely some big telltale signs, but the thing that I kind of say to everybody is, how many postpartum mothers have you heard say, my body feels exactly the same as it did before I have kids, right? Like none, nobody ever says that. So even if nothing's wrong with your pregnancy, there's so many good skills that you can learn, including labor prep. Most people don't learn how to push their baby out until they're having their baby. Not really the best time for some on-the-job training. So I really do feel strongly that even without a problem, everyone should have pelvic PT when pregnant. However, some of the big bad things that are like, you need to come see me. Pain is not normal with pregnancy. We normalize it. Again, it's very common, but that is not normal. So if you are having significant low back pain, sacral pain, SI joint pain, all of these things tell us that you need to be a little bit more stable. We need to tailor an exercise program for you so that we can get you breathing, bracing, engaging properly to get all of those things active. If there's pubic symphysis pain, so this ligamentous area here on the front, if that, as expected during pregnancy, widens and separates as it should, so we can grow big, happy, healthy babies. But that can cause a lot of pain and discomfort if that happens too fast and the surrounding muscles aren't stabilizing us enough. So those are certainly problems, in addition to, of course, any leaking of urine with cough, laugh, sneeze, can't make it to the bathroom fast enough, pain with penetration, all those things. Also, one of my big red flags is if someone notices any coning or doming of their abdomen. And so that's basically when we notice when doing, again, a flexion-based movement, like a sit-up, people always tell me, oh my God, I sat up off of the couch or I sat up out of bed and there's like this whole big bulge happening in my belly, like what's going on there? That tells me that we're beginning to see the start of diastasis recti. And again, that tells us that you are not managing your intra-abdominal pressure well. There is a problem in the system there. And that's something that we can minimize that progression so much during pregnancy if you know what to do about it, so that postpartum, you're not dealing with, abdominal muscles that have kind of split and then you don't have any strength to fall back on.
So for our postpartum mothers, how soon after childbirth do you recommend that they start incorporating their pelvic floor exercises into their fitness routine?
Great question. So truthfully, where I begin with everyone is just some of your gentle, simple core activation exercises, which, are looking like, like supine marches, like laying on your back, like getting at the like very simple, basic things that I'm starting, 2-3 weeks postpartum. We start to get into the good stuff at that 6-week checkup mark once the doc gives you the thumbs up and says you can come back and see me. And then we really start to see specifically for you, what is the problem here? But
Because let's face it, it's about client dependency. It's not what you see on Instagram or, you should be doing this at 6 weeks postpartum.
right,
It's all
exactly.
client dependent.
Exactly. Yeah. So I hate to give that like PT answer of it depends.
We say it all the
We
time.
say it all the
We say
time.
it all the
Yeah.
time. Is
Yeah.
this bread good for me? Well, it depends. What
Yeah.
are your goals?
Exactly. Yeah. But for most people, things that can always, benefit us are any of those anti-rotation, crossing midline, diagonal type of movements. What we don't really think about in the prenatal phase is that, again, you're going to be doing really awkward things for those, for that first year. But that's like holding a baby like this, trying to feed them for a long time. So I'm getting people doing chest openers. I'm working on thoracic mobility. I'm making sure that they have good grip strength, that they have strong biceps, that, they can do farmer's carries for, with a 30-pound kettlebell, and that's those baby carriers are brutal. They're so awkward and they're so heavy. So, or being able to hinge well. So I'm having people doing like good bent over rows, good mornings, all of these kinds of things, because that is lowering your baby into the crib. That is picking them up so you don't wake them up, all of these things. And so you want to be great at those before you are a little bit sleep deprived, a little bit hormonally deprived, and, have a really mean boss who doesn't tell you what their problem is. They just scream at you and cry all the time. So, you want to be really, really on all of that before you're figuring it out for the first time.
And so with postnatal women getting back to exercise, like you said, a lot of the times when they go to the OBGYN, they're just like, okay, go back to what you're doing. Obviously, it's a progression because some people, like you said, may want to just take a yoga class and some may want to get back to deadlifting heavy weights. How do you work them through that progress?
Mm-hmm. So, I have a really cool return to running protocol that I love to do with all of my runners. It's so cool because people think about, oh, like running is the easiest thing for me to do postpartum. I'll just lace my shoes up real quick and I'll hit it around the block. But like, what is running at the end of the day? It is single leg stability. It is, force production and absorption. It is a lot of pressure. When we when we measure intra-abdominal pressure, that's one of the heaviest pressure, highest impact activities. So if you had a C-section, like don't even think about running, at that 6-week mark, so that's, especially with my runners, I'm always pumping the brakes on them. With my barbell athletes, I'm usually saying like, let's talk at 12 weeks, let's bro out for a little while. Let's do a ton of accessory work. We can get you strong. You can touch weights, but like, doesn't need to be a barbell yet. So those are some of the things that I'm looking at. But really a simple battery of tests of like, can you even sit up off of the couch without support? Can you lower yourself down with control? There's so many people who are terrified to do any kind of sit up adjacent movement because all pregnancy they were told don't do anything core, and then they're like, oh, am I gonna split my abs open with this? Am I gonna give myself diastasis with this? There's so much fear surrounding pregnancy, prenatal, postpartum, and that is something that I just really want to fight, because we are so strong. Like, you have to be so strong to carry a baby, to make a baby, to have a baby. That's any way that baby gets here. Like, you are a badass if you did that. So like, yeah, you can sit up, that's one of the things that I really love about what I do is everybody walks out being like, you make me feel like I can do this again. You make me feel like I'm going to have my life again. And I've had some amazing power lifters who they're deadlifting, maybe off of blocks, but until they're 38 weeks pregnant, I love keeping people training as long as I can and getting them right back to it. So usually the way that I get people ready for that right now, I have an awesome CrossFitter. She's probably like 27 weeks pregnant. She's been doing the open and she's killing it. She's modifying, but It's awesome. So keeping people active as long as possible, that makes their postpartum so much better.
And to wrap up this portion of it, what advice or tips would you give to women who are currently pregnant or planning on becoming pregnant regarding maintaining their pelvic floor health and fitness throughout the journey?
Mm-hmm. I would say don't do Kegels unless you know for a fact that you need them. And the way that you know for a fact if you need them is if a trained professional tests your strength. Chances are, if you're doing them, you're probably doing them wrong. And that's really hard to know unless someone checks that out. So what I find in a lot of pregnant people is the minute that they hear that they're pregnant, they're like, okay, like I've heard what I do now, it's Kegels. And then they do them wrong, and then they wind up creating pelvic floor tension, which we're already predisposed to do because these muscles have never had to work so hard in their lives. So they just kind of tighten up to pretend to be strong. And then some of this pelvic pain can kind of start to occur. So that would be kind of one of my things that I tell everybody is like, unless I tell you otherwise, you're probably not doing Kegels. And then generally understanding that your core and your pelvic floor are best buddies because they're all in the same system. And so if there are any, lingering issues that you've kind of pushed aside for a while, plan for them to rear their ugly head during pregnancy, whether it's like my back kind of bugs me sometime or my one hip isn't so great and all of these things, we sort of expect them to flare up. So be on your recovery game, be on your mobility game, be on your single leg strength game, your, all of these kinds of things. Like those are so, so helpful. Patching up any of those weak spots when we're in a place to do so, again, will make your pregnancy and your postpartum so much better. And again, shameless plug, but get in to see a pelvic PT because this is what we do all day, every day. So,
Oh, that's not a shameless plug. We're gonna we're gonna plug away on you. Yeah, absolutely. And there's so many. We got to have you on again because I have so many other questions I want to dive into, especially working with predominantly females. There's some things I just don't know. Like I have an idea, but man, you went in depth and really explained so much stuff. It was so awesome.
awesome.
Do you want to give everybody
Another
your social
super
media?
friend.
I know, right? Can you give
Yeah.
everybody, we'll attach it as well. We'll put this out on YouTube and we'll do clips as well. But can you give everybody out there information to contact you?
Yeah. So my Instagram is Christine Abrams, DPT. So just my name and Doctor of Physical Therapy, DPT. And then I work at Ethos Performance and Pelvic Rehab. I'm on North Forest, right near UB's North Campus. And I work with two awesome orthotherapists. They're so great at what they do. Whenever I bang myself up doing something dumb, they're the first people that I call. So they've got a great background. One of them used to work for the Bills. The other has a strong neuro background. So he's great at vestibular stuff. So they're an awesome crew to be with, and I get smarter by being around them every day. So they're also phenomenal. So that's also where you could find me over with Ethos.
Yeah, I already want to have you on again. I so want to touch on next time men and pelvic floor. Like,
Yes,
yeah, but we'll save that. We'll save that.
Great. I can't wait.
So thank you so much for coming on today and chatting with us. We really appreciate it. But before we let you go, we're going to have some fun, and Coach Beth has some questions for you.
Okay. Of course, everybody loves to hear the professional side, but now we want to hear the who you are. We want to know the deep down fun side about you, right? So we want to know, what are your top 3 restaurants in the Buffalo area?
Ooh, okay.
Because we like food, so let's talk about it.
All right. Oh, well, Prescott's Provisions is one of my go-tos. It's over I believe it's technically in North Tonawanda, but they do like local seasonal stuff. Their menu is phenomenal. It's always changing, and I have never had a bad meal there. So that's one of my go-tos. This isn't maybe like a food restaurant, but I am a coffee snob. I love coffee so, so much. One of the things that I put on my wedding registry was an espresso machine because that's my jam. So Overwinter is my favorite place to get coffee. I love it there so, so much. And my other drug of choice is ice cream. So one of my favorite places is Churn on Hurdle. And so they're attached to Lloyd. They have that amazing soft serve, like Ithaca ice cream, and they're like my die for thing from there is their churro sundaes. Like
Mm.
whoever thought about putting a churro and a sundae in the same place is like amazing.
So when you're not thinking about calories, you're not thinking about the most healthy thing, what is the one meal that is your most favorite indulgent cheat meal?
Great
Is
question.
it that churro sundae?
I know, right?
It's the end of the day. You don't care. You just want to eat that good old dirty meal. And what is
Yeah.
it?
Yeah, you know, I do love a good bagel sandwich. So like everything bagel, bacon, egg, and cheese, like garlic cream cheese, like oh, like that's kind of one
All
of
of
my
the flavors.
hungover, like savory.
Yeah, we all know those. So when it comes to your desserts, are you a sweet or a salty girl?
Mm. I do love a salted caramel, so that's kind of up there. So it's a little bit of
It's a
both.
little bit of both. I agree. I love that little bit of sweet and savory and that sweetie and salty all together.
Yeah.
All right. The people need to know, what TV show are you binging right now?
The Sopranos. I'm throwing it back.
Throwback. Wow,
It is a
okay.
throwback. I
Wow.
need a good throwback to go to. I feel like the things that have been on lately, I'm kind of like,
Yeah, I
nah.
know.
But plus, we're getting into the warmer weather, so it's a little bit harder to want to sit inside. So I think that's a safe choice to go back with a throwback with Sopranos. And
Yep.
yes, it's a good choice.
How
And
far are
Christine,
you in it? How many seasons deep are you?
I'm in the second season.
Oh, nice. You're just getting started. Oh,
oh, you're
Mhm.
nice.
just getting started
You
again.
can tell by how I talk with my hands that this is very near to my heart. Like I wouldn't be able to talk if I was sitting on my hands. So,
So it's very fitting. And then, Christine, at the end of your day, what do you like to do to de-stress?
get in my hot tub, which is what I'm about to do right after this.
Awesome.
Fantastic. You're a seasonal. Do you keep your hot tub open all year?
365.
Me too. I know. Yeah, me too.
I'm really trying to convince my wife to get one.
Yeah. You know, during COVID, I went to an Airbnb that had one, and I was just,
Oh,
this is what I need. We got to do it.
It's so cold outside and you're sitting with that steam coming around you or the light snow coming down. There is nothing that beats it while you're in there. There's nothing. It's the best.
Exactly.
that is awesome. Well, Christine, thank you so much for joining us today. Again, I'll post this on all of our social media platforms. We'll get all your information, tag you in that, and we'd love to have you on again because we have so many more questions.
Lot to go over. Yeah, there's a lot more to go over.
But thank you
Oh, I
so
love
much
it.
for joining us. So for myself and Coach Beth, we will catch you guys next podcast.
We'll see you later.
Bye.